My name is David Carnovale, and I'm the Medical Director for Fertility Specialty Care at Community Health Network. Personally, I went over to using the robotic system in 2010, and since that time I've done about 300 robotic cases. Many of those are for endometriosis utilizing laser, but many are also for the myomectomy procedures. Intraoperative ultrasound provides advantages over many of the other types of imaging that we have available for patients who are having procedures where they may have a mass inside their uterus that we suspect is a fibroid. If the fibroid is embedded in the uterine wall itself and the contour of the uterus is not distorted, it becomes very difficult to know where to locate your incision effectively. All surgeons who've done this kind of procedure, I'm sure, have had the experience of making an incision thinking they're going to be over the fibroid and finding out that they missed the mark. And with the ultrasound, this is much less likely to occur. One of the unique types of patients where using the intraoperative ultrasound is very critical is the situation whereby someone has a cavity distorting myoma that attempts have been made to remove hysteroscopically. I've had a patient like that, and I've had another patient sent to me where they had undergone 2 hysteroscopic procedures, and despite both of those procedures being done, they still have a mass found at their next visit. Flattened out myomatous tissue is aggregating and balling up into a more identifiable discrete mass once the portion that's inside the cavity has been removed. By going from the pelvic side, we're able to use the ultrasound to identify all of that mass to be more precise in removing the mass in question and to make sure that the patient doesn't end up undergoing another surgery because something was missed. It also allows us to be less invasive for the patient's surgical procedure. If you think about it, if we're making a blind incision into the person's uterus, thinking we know where the fibroid is, missing it, and having to close that cut and making another incision, then that's a lot more invasive than having a very directed, real-time, ultrasound-guided incision that we know is going to be right on the mark. So really, the ultrasound just brings so much more to the table in allowing us to be precise in where we make our cuts.